So if you're going to the doctor, you want to make sure your doctor is doing a few things to confirm that he's a legitimate doctor. Now, you may say, I've never heard of a corrupted doctor before. Well, there's doctors can be corrupted in a few different ways. Besides, you know, dealing out medicines they shouldn't be dealing. They could be being lazy, which is a form of corruption. They could be trying to cut the corners to get out of their job faster. You know, they could be doing things just like slacking in their, approach by just like, say if you tell a doctor a symptom, he's going to just search it up on Google. He's going to go in the other room, search it up on Google, and say, this is what you got. Okay, a doctor doesn't have every disease memorized in his brain. So if you go in the doctor, you have a symptom, the doctor's going to go in the other room, he's going to look it up on Google, and then he's going to come back and tell you what symptom you actually have based on a Google search. Okay, so now that isn't the most corrupted part of being a doctor. The most corrupted part of being a doctor is when they cut the corners and basically don't give you the options that you need and don't give you essential things like vitamin testing for vitamin deficiency, blood work testing, and basically other things like that, cortisone level testing, which is blood work testing. You know, he could test all sorts of things with your blood work. So you want to make sure that you have no autoimmune disorders if you're having chronic illness, because an autoimmune disorder is something you want to catch early on. Now, I have studied naturopathic medicine and wellness in college. However, I did not complete the degree, but I did take many courses from professionals and had studied many hours on these topics and have gone to naturopathic doctors myself, which I view as superior in many ways to a primary care pharmaceutical doctor, because the reason is that naturopathic doctors in some states are considered equivalent to a pharmaceutical doctor. So that means they recommend plant medicine and things like exercise and vitamin diet deficiencies, and their goal is to really make sure you're living like a healthy lifestyle in conjunction to the medicine that they're prescribing you. And they're going to prescribe you plant medicines before they give you a pharmaceutical medicine. They're going to recommend you the plant alternative, which, you know, if you think about it, pharmaceutical medicines only were invented about 200 years ago. And this was due to just laboratory testing in, they would create these chemicals in laboratories and give them to people. And that's basically what pharmaceutical medicine is based on, where naturopathic wellness is based on finding more natural, cures for illnesses. But if you have something like, say you have chronic inflammation, or you have some kind of, chronic illness, that like mental health illness, you want to make sure you get the vitamin testing and the autoimmune blood testing and make sure you don't have an illness which is causing your second illness. So if you have just a symptom, say you have a symptom where you have inflammation, say you got arthritis, or you have, you know, you're extremely lethargic. Well, you may have a separate illness which is actually causing those symptoms to appear. So say if you have extreme stress in your life, it's actually going to cause you to release abnormal amounts of stress-related chemicals like cortisone, which is, could be diagnosed as a few different things. But if you just take the basic symptoms and try to diagnose them in 2 minutes, you're just going to diagnose them with stress. Okay, you're going to say you have stress or you have anxiety. Well, did they ask you if you're exercising enough? Did they ask you about your vitamins you're taking? Did they ask you about your fiber content? Did they ask about how much, if you're intolerant to certain foods, or feel like you're having reactions to certain types of foods? Have they done cortisone testing on eating certain foods? Now, have you seen the testing on cortisone levels with meats, sugars, and gluten and dairy? Well, everybody is going to have a different reaction, but in some sample studies, it has shown that people who eat high concentrations of wheat products or oats actually have extremely elevated cortisone levels, which elevate your stress level, cause you to have histamine, hyperthyroidism, and which can lead to allergies in different ways. And if you're not getting all that testing done, if your doctor doesn't even recommend that you get a blood test after testing out certain food diets, it's simply a doctor not doing his job. It's simple as that. A doctor isn't going to give you all the information you need if he's a bad doctor, if he's a corrupted doctor. He's going to give you the lowest amount of information he can. He's going to take think about it. A doctor is someone who went to college, just like any normal person who goes to college. He did his studies, and he graduated, and then he applied for a job. Okay, he's a millionaire, sure, but he's not somebody who is always the most intelligent person. Like, you can get a college degree and be very low intelligence, extremely low intelligence. Getting a college degree is not very complicated if you have financial backing, or you say you had parents who forced you into getting a tutor for every class. Like, you're gonna get into college pretty easily. It's not gonna be that complicated. But the thing about it is, most doctors don't want you to even tell you this information, even if they know that this is like the way to truly go about an illness is to test your blood levels after eating certain foods to make sure you're not having any reactions which are causing the symptoms. Or say you just are deficient in a vitamin. Well, that is an extremely important way to go about naturopathic medicine, which they simply don't want you to know about, because bad doctoring, bad medicine. You ran into a guy who just wanted to make money being a doctor, and he doesn't want to give out all the specific information to every patient because he treats 50 patients a day, 100 patients a day if he's in urgent care, and he doesn't even care about You know, you think an urgent care doctor would care more? Well, they don't. Their level of caring is limited because, you know, a lot of these doctors are just like a guy working at Walmart who happened to get a college degree. They're not necessarily super intelligent and want to help out everybody. They're just a guy trying to make money, and he's going to give you your basic information that he can get away with, but isn't going to delve deeply into the pharmaceutical industry and how you need to really get testing for your vitamin levels and get your blood work done on a regular basis if you're having chronic illness. So that's also a way to catch diabetes very early on, catch cancer very early on, is to get these blood work tests done. But if a doctor is too lazy to do them, he could be responsible. If he won't even educate you, see, it's not really doctor's job officially to educate you on the whole system, but it's such a simple talk you could give to your patients, which would take about 2 minutes. They can't even give you the 2-minute talk about how you might want to test your blood levels and to test for autoimmune diseases because they're too lazy. So if your doctor isn't giving you the talk about testing your blood levels for vitamin deficiencies, testing to see if you're having reactions to certain foods you're eating, like you may want to go in one day and get a blood test after eating a pile of pancakes, and then maybe the next day you get your blood work done after eating, you know, a bunch of chicken. And then maybe the next day you go in and you eat a bunch of sugar and test your blood work. And these three things, if you eat a bunch of sugar right before you test your blood work, you're probably gonna show up by having high blood pressure. But say if you didn't eat the Dunkin' Donuts coffee in the morning, it might not tell you had high blood pressure. And this is the little trick that the medicine industry doesn't delve deeply into, because it's a long conversation to have, but it's something I recommend.